Assalamu alaikum wa rahmatullahi wa barakatuh. It's my honor to be with you here today. And I want to thank the head of the department, Salalah Hospital. In fact, for a long time, I was telling my colleague, Dr. Naima, that for a long time, I want to meet you and see how is the hospital. We had a chance last night to go and see the department. I'm really, I don't know how to say that, how people are really working, you are really very nice. Taking a lot of burden of the whole region. It's really very, very good. Thank you very much. So I hope that I will be 3 lectures is not an easy thing. Inshallah, you will not be fed up from me. In between, you will get na'ama, so nice things in between. I will start about the overview on fertility management and challenges in Oman. My introduction, I will talk about the infertility. As you all know, that it's a sort of a global public health issue. Prevalences of infertility worldwide and in Oman, the gap of infertility treatment in Oman, the needs for private institute fertility service. Then we will talk about the levels of fertility clinics in Oman from our perspective and how it should be, and we hoping that the ministry will take it in the future, inshallah. Important points for any ART center when they want to open in Oman, and how the codes and regulations available in the Ministry of Health, how we usually check these IVF centers, the challenges and useful regulation which is available right now, how to pick, this is for the general, how to pick a good fertility center, and finally I'll summarize my presentation. If we come to the infertility, I want you to see this map. You can see here that how is in 1970, the number of children per woman in 1970, let us take our region, for example, Oman, or the whole world to start with. The gray area, which is 2 to 3, is the maximum area, 2 to 3 children per woman. This is in 1970. In Oman and the rest of the Gulf countries, we are in red in 1970, 7 to 8 children per woman, okay? Okay, yeah, good. Okay, and so this is in 1970, which is really a very fertile. You see this, people get at that time that we are really producing a lot of babies here, and maybe the whole earth will not be accommodating us. Okay, 50 years later, within 50 years, look to see. Now the whole world is in this blue one, which is 1 to 2 child per woman, okay? And look to our region. We are here now, 2 to 3 children per woman. So in 50 years, there are lots of reduction in the fertility. And of course, there will be a lot of reasons for that. Okay. I'm pressing. Huh? That's not working. It's okay. It's okay. Okay. I thought maybe there will be some changes in 2019. This stay is as it is. In 2022, this is the recent one, which I got it from the World Health Organization maps. We are again around between 2 to 2.5 in Oman, if you want to talk about Oman. Okay, so fertility, it is a global public health issue. It is. It's not only in Oman, it's worldwide. So what does that mean? According to the World Health Organization, there is 1 in every 4 couples in developing countries have been found to be affected by infertility. It's a serious thing.
Yeah.
There is also, and that is coming up to 48.5 million couples looking worldwide for fertility service. Not only that, we start finding that this increasing fertility incidence is not only in one area, it's global. So if you come to this article, which was published recently, that the infertility prevalence was highest in the South Asia, Sub-Saharan Africa, North Africa, and the Middle East. What does that mean? You expect if I show you the fast map, which I show you, that the reduction will be not dramatic, like you have, for example, 2 to 3 children per woman in 1970, and you will decrease in 30 years to around 1 to 2 child. But what is happening now, it's not that way. It's the decrease is dramatic. From 7 to 8 child per woman, it decreased to 2 to 3 child in less than 50 years. So that means there is an issue here. We should not just ignore it. And why is that? The data is lacking in the other countries, and it is somehow neglected. We don't know why it's neglected, because maybe people thinking that the resources of any countries will go to other issues rather than infertility, or nobody wants to speak about infertility as an issue because they have other important things they think rather than infertility, maybe. Okay, so not only they found that it is the global issues of the infertility, even there is discrimination in the treatment, that in some countries they find that the minority, the Black people, for example, the Asian, they will not be treated like the other people in the same country. And maybe even here, if I can say that in Oman, as you said, we have maybe many services in the north, which is not available in the south in that way. So it is, the risk is of infertility, it's coming with other risk factors, not only infertility. We have to think about the issues which make these ladies infertile. So maybe this is just a repetition that the infertility is coming with a lot of burdens, like psychological, social, which will be a demand for any health services. Imagine that the social, the separation will increase, the psychological need for psychological support, the social support. Maybe the causes which make these ladies infertile will be more burden on the health, any health institutes. So the prevalence of infertility worldwide is around 15%. This was around, yes, now maybe the prevalence of infertility is similar to almost like diabetes in some countries. So if the prevalence of infertility is around 15%, and in some countries, the diabetes also 15%, now in Oman it's around 20 to 25% the diabetes. But so that means it is an issue, we should look into it. We should not ignore it. Not only that, we come to that worldwide, the male infertility start increasing. 1 in 8 men now are diagnosed to be infertile. 1 in 8 couples, for example, in USA are infertile, 1 in 6 in Canada, 1 in 6 in British. And as I said before, the semen analysis, if you see the semen analysis reports from the World Health Organization from 1980, every like 4, 5, 10 years, sometimes they review these semen analysis, and it's decreasing by time. You can see here how much they decrease. In 1980, for example, see for example, this number of sperms which is required or which is recognized to be fertile. See in 2021, it's decreased dramatically, and it's decreasing. It's decreasing, and now we have more and more reports says that the male infertility is almost 50% as much as male. It's almost combined. In fact, in some countries, they are more than 50%. If we come to the most recognized issues about infertility worldwide, they say that the ladies now start putting work ahead of having families. When they're given the chance, which one you want a baby or you want to go back to work, they will choose to have work rather than babies, okay? And I cannot say that is totally wrong, but that is the issue. That is one of the reasons. So the long working hours is also an infertility issue. So if you come, for example, they are well known that some of the works are higher prevalence of infertility, like those who are working in military, for example. Those who are having, as I said, when in the military is having more infertility, and I can see that. Even in our incidents now, I can see observation that those who are in military, they are having more incidents of infertility. Unfortunately, medical career is one of it. So medical career also is one of the jobs, unfortunately, who have the higher chance of having infertility. What about Oman? This is an interesting article which was published in 2017. It says that rapid fertility decline is decreasing in Oman. So we are one of the highest community worldwide who are having dramatic decrease in infertility. We are, as I said before, we was 7 to 8 child per woman in 1970. We end up now having less than 3 children per woman in 2022. This is not only in 2017, it continued after that. And unfortunately, this is the recent one, it is published in 2022. Now, the number of children per Omani woman is only 2.3 average, okay? So everything in Oman is increasing, except Oman fertility rates is decreasing. As you can see here, Oman fertility rate is decreasing with time. And I know you see that the infertility is really increasing, and there are so many, even in the Ministry of Health, lots of their, in fact, lots of their statistics coming. It shows in that way. I was surprised that how much you people are seeing per month. Infertility, it's almost like royal. We saw around, I have the, but I didn't put it in my lecture, but we have the number of females seen in the fertility clinic in 2021. It was almost 1,000, close to 1,000, and you people are almost more than 800 or 900. So it's almost like royal. So it's really, you have a huge, and in royal, we are not seeing only Muscat region, we are seeing the whole Oman. Imagine, so that is not only Muscat. So you people are really having a very high incidence of infertility. And in fact, even in the ministry, the statistics, now there, you know, that white booklet which you have, it shows that the number are increasing, but we believe that these numbers are less than what it is there, because there are so many who are going to private and they don't open that white booklet anyway. Okay, so yes, infertility is arise among the Omani youth. And this is one observation which was published in 2018 from one of the IVF centers, says that the Omanis are really having, male especially, they have a lot of infertility issues with a lot of reasons: parental consanguinity, as we said before, vitamin D, obesity, smoking, so many things. So as I said, tobacco smoking is one of it. You can see that 60% of the Omani population is overweight or obese. This is really huge. So imagine this will be our community, 60%. Not only that, those who are in teen age, below the age of 25, it is 33.7. So these are our future. These are the people whom we are going to look after them after a few years. They will get married. So imagine we will start having now more and more patients in the obesity category to whom we are going to look after. And that is because of the lots of habit in the food. You know, we are not doing much exercise and all that. So with all this, can the Ministry of Health accommodate all these numbers? No, of course not. We are not going to accommodate all these numbers. We need help. We have to say that we need help from the private, Because we cannot. There are so many reasons that we cannot accommodate all these numbers. Male infertility is increasing in Oman. We have to admit that. And we can see that from the incidence, which is available also from the Minister of Health. And we need more and more urologists, maybe reproductive endocrinologists, male fertility specialists who should take care of these males. So yes, the need for private is there, and we need to improve it, or we need to cooperate with them. Okay, so what type of clinics we have in Oman in private? We have mainly the general OB/GYN, qualification of the treating doctors. Most of them, they are general. Maybe they have not much apart from the general knowledge in the OB/GYN or the knowledge they got it during the residency, those who did the residency program. Not much, as I said, fertility specialist. We need the guidelines, specification about the management we were talking about just now. These clinics should have their restricting criteria, specifications, maybe levels. We need sort of monitoring to improving. We are not criticizing them. We need to improve the service. I will not say only in private, but also as well as in the government, we need to improve that. And of course, we need the male infertility specialist. So what we can see now, the levels of the fertility, they are dividing, I can divide them into 4 levels. The centers, according to the certification of the doctors and the type of management they are giving. The level 1, usually they have the fertility medications, including oral and gonadotropins, which is the injectables. The oral is usually Clomid or Letrozole. And usually we hope that these no fertility treatment should be given only by the OB/GYN, because we hope that the OB/GYN should have at least some knowledge of fertility treatment. We should have somebody who is experienced in ultrasound to monitor these, and they should have some doctors who can help them. The level 2, where you add the intrauterine insemination, which is unfortunately not available in many of the governmental hospitals. And when you have to treat with the orals, gonadotropins, and you get have the intrauterine insemination, unfortunately, we don't have much people who know why we should do an IUI. Sometimes we do see patients are given the IUI when they are not for IUI itself because of many reasons. Then we go to the level 3, which is assisted reproductive technology, where this should only be run by an REI specialist, those who are board certified. And then they have the level 4, which is the centers can do with that, the BGD and BGS. So in 2017, Minister of Health put a fertility standards and regulations. These centers usually monitored by a group of us who are certified in the reproductive medicine. We go and visit these centers and we check them. We were doing it almost every 2 years. The latest we did in the beginning of 2000, where we accredited these centers and tell them how what is their level. So it's a huge market. It is, fertility is a huge market. So, and it's the need for it to monitor, it's very important. You can see the IVF centers worldwide. You can see how many of them in the Middle East, so that need to be regulated. So it's becoming like a business. So because it's becoming like a business, there is more and more need to have a trained people and to be monitored. There are so many here, just that even the World Health Organization recognized that, and they said, yes, there is a need to monitor these centers because they are can deviate from whatever they are supposed to do. So even the other, like SRM issues, there are other guidelines they publish their guidelines how to monitor these centers. They have to have medical professionals, legal experts, patient advocate, and government representative in all of these to put these guidelines. Not only in as I said before, it's in Oman, we have deficiencies even in this booklet. We need to have. So this, I found this publication, which was published recently, regarding the review assisted reproductive techniques, laws and regulations in the Muslim countries. When I found it that they put all the Muslim countries, and you can see the deviation in the rules and regulations. So we don't have even ourselves as in Muslim countries, one rule to apply. So there is one, which is accepted in Oman, maybe not accepted in UAE, for example, which is just a nearby countries. Till recently, there was for example, freezing of embryos was not allowed in UAE. For example, something like which is very extreme, like sperm donation, oocyte donation. It is not allowed in most of the Muslim countries. Where in nearby country, Muslim also, which is like in Iran, it's allowed and it's legalized. It's there. It's available in many cities, and they publish it. So these sort of things also will make people confused why it's allowed in one country and it's not allowed in other countries. Myself, I get also confused. Okay, so because of that, the IVF centers need to have really, it should be only designated to people who are academically qualified in order to be practiced in these centers. And the staff should be always trained, and they should submit, and that's what we usually do. They should submit usually a yearly report to the private sectors regarding their number of patients, cancellation rate, pregnancy rate, and their level of the OHS. And they should have their own rules and regulations, each center, to what they are supposed to do if any of their staff absent, for example, and they are doing some monitoring for some of their patients. What if they resign, how they should inform the authority, what they are supposed to do, how many numbers of embryos they transfer. Like, for example, it's well known around the world that 24% in any new center allowed 24% if you have a good lab. 24% allowed in the first year, so they come to know that they have a multiple pregnancy rate of 24%. It will be accepted in the first year, so they know that they have a good lab calculation for that, but you need to reduce that. So then the next year they should reduce it to 20 till they become 10 to 15%. So also multiple pregnancy, and that will be monitor how many embryos they transfer in each cycle. So this is the regulations and rules. I'm just putting it all together. And some like sex selection, for example, in Oman is not allowed for social reasons. It's not allowed. It's only allowed if there is any for BGD reasons. Embryo reduction is also not allowed in the private sectors. It's only allowed in the governmental hospitals. So this is the checklist which we usually do when we go and visit the IVF centers in Oman, and we go through their lab, and they have to give us their rate of multiple pregnancy to monitor that, because we are facing that issue in the governmental hospitals, because they end up all these preterm babies, they end up with us. So yes, we have challenges. Like the number of qualified doctors available in the private is not much. There's not enough governmental resources for fertility treatment. We have to admit that. There are not enough male fertility specialists available. Who should do the audit of the IVF center? I put that for me, because we are ourselves, sometimes we're facing some issues when we go and audit other private sectors, when we ourselves doing practice in one of the IVF centers. So it's sometimes not accepted by those IVF centers. So that's why we always ask the ministry to bring an auditor from outside to do that audit, which is sometimes can be done, sometimes not, most of the time cannot. Education of the community need to know that what these IVF centers, what is the meaning of it, fertility management, and what is their right, and to choose the best IVF centers, and the health education for the, as I said, for the public. So yes, we need these usable regulations regarding that. And for the general OB-GYN, you need to know that when to stop and when to refer for further management by the fertility, and when to refer these patients for the IVF specialist. And we need to protect these infertile patients who are emotionally, and they are really suffering a lot emotionally, financially, to get a fertility treatment, and finally they could be stay for a long time in one place doing almost nothing. They're wasting their years for nothing. The dropout for fertility, unfortunately, is high, and that's why we need the regulation to stop this dropout. We don't want a lady, she continue in a place for about 3-4 years and then she drop out without, because of the financial or any other reason, without giving her other. You have to give a good advice to these patients before that nobody will stay forever treating for infertility in one place. They will go shopping from one area to the other, but they need somebody to give them the good advice. So how to pick a fertility center? This is just, I put it that for anybody, you need to know, if you want to send any patient for any IVF center, you need to know what the qualification of the doctors available in that IVF center, how many physicians are available there, are they part-time or they are full job in that center, that the practice of that fertility center is monitored by the Ministry of Health. Is the fertility practice center of excellence? They have any qualification from any international accredited centers? Does the fertility center doing BGD, BGS, for example, do they have their own embryologist or they get embryologists from somewhere else? What the insurance, if they are accepting insurance, that the fertility clinic offers such more support service like social workers, nurse guide, and all these centers? Is the fertility clinic involved in outreach resources and others? So in summary, yes, in many areas, fertility management, availability, and access is questionable. Diagnosis and treatment of infertility is often not prioritized nationally, unfortunately, but the reproductive health strategies are rarely covered through the public health, as I said before. Lack of trained personnel it's there, and we have to admit that we need to improve those who are treating fertility couples. It's it's costly. Assisted reproductive technology such as in vitro fertilization, most of the time unfortunately is not available in most of the areas. For example, in Oman, it's mainly available in Muscat, and people have to travel, and like from Dhofar, they have to travel, they waste lots of time, they stay for about 2 to 3 weeks in one area, and that is a lot of social and economical burden. And many of these patients, unfortunately, cannot afford for the fertility treatment. We have to have a governmental policies which need to be recognized that fertility is a disease which can be prevented. And how we can prevent that? We have to have a fertility awareness. We have to have a sexuality education programs, promoting health lifestyle, reduce behavioral risk, including prevention, diagnosis, and early treatment of STDs, preventing complication of postpartum sepsis and abdominal surgery, which end up with complication like adhesions and tubal factors. And we have to address environmental toxins, which is associated with infertility. The policies, laws and policies and regulation of the RT have to be monitored by the higher authority, and that's it. Thank you very much.